Hello, everybody. This is Gary. Today is Monday, February 20th, 2022. It's 11:38 a.m. and this is February. It's a short month. Tomorrow is the March. This is my coping with schizophrenia blog entry for today. And today I just wanted to do a quick update on my taking the antidepressant Cymbalta for physical pain. Over the past 5 or 6 weeks, I've been having a lot of severe joint pain, muscle pain, arthritis pain, muscular skeletal pain, and nerve pain. I started taking Cymbalta about 3 ago. We started at 60 milligrams a day, and we jumped up to 120 milligrams a day, which is actually pretty quick dosage increase, quicker than normal. But I think I was in such pain, my doctor wanted to see if the Cymbalta at the higher dose would help. And overall, I would say that my pain is a lot severe than it was 3 weeks ago. I still have some leg pain, pain in my arms, pain in my back, pain in my left hip. I do have arthritis in several places in my body, my hip, my upper and lower back. I also have bone spurs in my lower back and in my knees. So there's a lot of different things that could cause physical pain in me, including arthritis and bone spurs. Um, but the Cymbalta seems to be reducing the overall severity of the pain, and it does fluctuate. Some days are better than others. Some days are worse than others. Um, Whether or not Cymbalta will help me with my depression or not, and my anxiety remains to be seen. Because Cymbalta can also be used for anxiety disorders and, of course, depression. It is, after all, an antidepressant. Um, my right knee doesn't hurt as much as it did just a few days ago. Um, it's easier to walk on it. I had twisted it on the bus and I went to urgent care where they x-rayed it, so there was no broken bones, but it was swollen and it wasn't dislocated. It's just that the soft tissues and possibly the tendons and the cartilage were damaged, which would not show up on an x-ray. But even the pain from that seems to be less severe. Now, I am scheduled for an MRI of my right knee just to make sure there's no cartilage or tendon damage that may need surgery. Um, but for now, the pain is a lot less severe, and it's easier to walk on my right knee than it was last week. Um, the pain may flare up again. It does tend to do that. Cymbalta is not perfect. My psychiatrist and my medical doctor, who's actually prescribing it, warned me that there's no such thing as 100% pain relief from any medication. Um, but I'm actually on several medications for pain. I take muscle relaxing Flexeril for muscle spasms, arthritis strength Tylenol for my joint pain. I take Aleve for the inflammation, and I'm also on Neurontin for nerve and musculoskeletal pain. So I'm on several medications to deal with the pain, and altogether they seem to be working pretty well. Um, it's about 11:42 a.m. I'm scheduled at 2:30 p.m. today to see my physical therapist. I have been doing my physical therapy exercises every day, and that may actually also be help reducing the pain. That is, after all, the point of physical therapy. Um, so far, we've been working on my entire upper body and my lower body, and I've also been using my exercise bike 1 hour every single day, inside, of course. It's winter outside here in Rochester. There's a lot of rain and snow over the past few days. It can be very wet and slippery and cold outside. That's why I'm very careful when I walk outside. If I wear sneakers, I tend to slip and fall on the ice. So I usually wear heavy boots when there's a lot of slippery snow, slush, and ice on the ground. I don't want to slide on the ice and injure my knee again. Because I also had my left knee x-rayed a few weeks ago, after I fell on the ice. It's very dangerous sometimes for me to walk on the ice and I lose my balance. The only other thing that concerns me is about the Cymbalta is my vision is a little bit more blurry when I look at the computer screen and try to read the newspaper. So I'm going to get an eye exam. I'm not concerned about it too much because I used to be on Thorazine and that made my vision blurry. And the only thing that needed to be done was that my prescription glasses be changed on the prescription so I can see better. And that's probably all I really need when I go to the eye doctor for that. As far as my psychiatric symptoms, they're not so bad today. My paranoia is pretty much low key. My auditory hallucinations are at baseline, they're pretty low key. My depression is certainly not that bad. My anxiety levels are not that bad. And I am still using Klonopin and Zyprexa twice a day for paranoia, hallucinations, and anxiety. Um, I'm not sure what the future of using Klonopin is. That's something that we'll be talking to my psychiatrist about on March 10th, which is when I see him next. I am seeing my therapist, my psychotherapist, on the 7th of March, and I will be seeing tomorrow at 2:30. I will be going to group therapy, which is once a week for 10 weeks, and then we're going to do another 10 weeks of group on a different set of topics, and that's been very helpful as well. So overall, things are looking better.